Hi, I'm Tracie Giles and I'm the founder of Tracie Giles Permanent Makeup in Knightsbridge.
And hi, I'm Dr. Charlotte Woodward and I'm the co-founder of River Aesthetics Cosmetic Medicine Clinic, and we have clinics in Harley Street, Bournemouth and Lymington.
I'm just so pleased today to actually share with you my professional friend, the very lovely Dr. Charlotte, who is a key opinion leader with all of the thread lifts, and we've kind of joined forces to enhance the treatments that we offer, and it's amazing. I'd just love you to tell everybody a little bit about what you do.
I'm one of the co-founders of River Aesthetics with my partner, with Dr. Victoria Manny, and the two of us set up River Aesthetics 11 years ago, and we specialise in non-surgical facelifts with threads. I think we do more than most other people in the country, and we use all the different types of threads, and we do face and body threads.
Yeah, explain to people about what the threads are and what they can do for them.
Okay.
So, you know, particularly lots of the clients that come to us will come to us for, say, their lips. Maybe they start to lose volume in their lips, or they're getting older, or they're getting lines around their mouth, or they're getting a little bit saggy here. And this is where I think that the combination of these treatments just is so powerful.
Absolutely.
So how would that work for people?
We're very much with the ethos of combining treatments, not just one treatment and maintenance. So it's not just one thread lift and then you don't need anything ever again. It is very much combining it with other treatments, with dermal fillers and botulinum toxin and makeup as well. So to give you that overall healthy looking face. So with the thread lifts, they're basically working on stimulating your body's collagen, and that's what we specialise in collagen stimulation treatments. So we do a lot of Morpheus 8, we do Alonze, which is a collagen stimulating filler, but threads is our
That's
passion.
your baby, isn't it?
Yes, our baby, our passion. And you can use threads in lots of different areas. You can use them to lift the brows, you can use them on the face, and we tend to use either Silhouette Soft or Mint PDO threads. They're our two go-to threads that we'll use, and the threads we pick depend on the patient's age and how heavy their skin is. We say to most people, we can get a centimetre's lift on your face.
That's amazing.
So you can get a centimetre.
A centimetre is actually a lot.
It is, especially with this area.
Yeah, for that nasolabial fold, and when you get the jowling, just 1 centimetre. Gosh, that's fantastic. And that can make a difference, I suppose, with somebody, you know, that feels that they've permanently got their mouth a little bit downturned. I mean, as artists, when we try and reconstruct the lip and make the lip look fuller, I mean, yes, sometimes we can use fillers as well, but you know, this is amazing because it can give you just that little lift and give you a happy lip.
It does, because so many people say that everyone says I look sad and I'm not. And they just and as we age, this is the bit that really gets us. I mean, the aging process, from the age of about 40, your estrogen levels are dropping, and then that causes your collagen levels to drop. And then when you go through the menopause, you age 2 years in 6 months. So your face, everyone comes and says, my face has changed overnight. And it has. You're not imagining that. Your face suddenly changes as you go through menopause. And then people just say, my skin's got more stretchy, and it has. You lose the elasticity. So keeping the collagen in your skin, especially in the menopause, is so important, because it keeps your skin tight and up, and it stops this sagging, and that's what everyone hates. It's this bit.
And I think, you know, the key thing is we get clients, as you know, that come to us from all ages, from all over the world, and I think the key is now is that with aesthetic medicine we have so many choices that we can actually help people maybe never ever have to have a facelift. So, you know, with the polynucleotides, which are real game changers, which is all about stimulating your own collagen, which is amazing, and then actually using the threads, which again stimulate collagen, allows the skin to support itself. And it's, you know, I think there's two lots of things going on here, isn't there? There's the clients that want to be really Instagrammy, the youngsters, and they can make a big change too.
Yes,
I mean, we work
absolutely.
on younger people too.
Completely.
Yeah, but then we also have the clients that, as you said, have gone through or going through or approaching their menopause and notice changes that suddenly, some of them for the first time will approach us because they're suddenly not happy with how they're out of control with the way their body's aging, their skin's aging. And this is amazing.
And everybody's thread is bespoke to them.
Yes.
So somebody who's very young, you probably use Silhouette Soft on them because they're more gentle. They're good for lighter tissue, for younger tissue, and you may only have 3 on each side, and a lot of people are actually having thread lifts as preventative as well. So people in their 30s, probably not in their 20s, but people in their 30s will have silhouette soft thread lifts because they just notice their skin starting to change. Then you get into your 40s, you can still have a silhouette, and but you'd probably put 5 on each side. And then as you get older, our lady's in their 60s and 70s, and my oldest patient is 88, and she's had a few thread lifts, and we tend to use the PDO threads on that age group just because it gives you more lift. So you pick and choose which one to use according to the patient's age.
That's amazing, and the fact is you make it for them. So every client is very client-centred, patient-centred on what that person needs. So we can take a look as a multidisciplinary team and have a look and make things work for that patient or client. How does it work? I mean, what's the actual journey? What happens when you have a PDO put in?
Okay, so when you have a thread lift, I always say to patients the worst bit is the anaesthetic, and then afterwards it's sore. But the procedure itself is not really uncomfortable because we anaesthetise the whole face.
Okay.
So you come in and we'll say to you all the things not to do beforehand, but we'll make entry points in the face, and they're also around the hairline, and we'll put threads in. We tend to sort of do them multi-directional, so you get that sort of cross-hatching and it gives you a better result, and you get a lift. It takes about an hour, and most people will put 8 threads on each side if they're doing a PDO, or if it's a silhouette soft, 5 on each side. And then what happens is you see a little bit of lift at the time. Some of that is just swelling from the procedure, but and then it takes 3 months to see the full effect. Anything that's collagen stimulated takes 3 months. You see a little bit of lift, and a lot of people phone us 4 weeks later saying, "Oh, I don't look any different." I think we have to keep reassuring them that their body's collagen is working. And if you combine it with other collagen stimulation treatments, like you say about polynucleotides or Alonze or Morpheus, or even just taking collagen supplements, that will all boost your collagen as well. So, and then by 3 months, you'll see the full results of your thread lift, and it lasts anything between 18 months and 2 years, and then you just have another one. And we have patients now on there. I mean, I've had 4 thread lifts in the last 10 years, and people just keep having them because they love them. And as you say, you may never need a facelift.
That's the game changer, isn't it? The fact that we've got all of these things available to us. And I think there's also a pull that I certainly get with the clients that come in to me that actually want something more natural.
Yes.
And of course, all of what we're talking about with whether it's the thread lifts or the polynucleotides is about stimulating your body's own collagen that we lose the ability to produce as we get older. So that's really powerful because some clients don't want to have fillers, or they don't want to have botulinum toxin put into their skin. So this is something that's quite natural, but can make you look a whole lot better and feel better. Very powerful.
So. I mean, a lot of our patients don't want fillers, and they've done their research, they find out about threads, and they come and see us because it's what we're known for. And I think that the big difference is if you keep having collagen stimulation treatments regularly, it's so much better for your skin than having a surgical facelift, because all a surgical facelift's doing is pulling your skin tight and taking it away, so it makes it actually even thinner. And as you get older, your skin's getting thinner, it's getting more stretchy, it's getting more crepey, and all you're doing with this facelift is taking that skin away but leaving the thin skin. If you're putting threads in, it's actually preventative, so your skin never goes back to where it would have been if you'd never had a thread lift or a collagen stimulating treatment. So you're improving your skin, and if you start young enough, say in your 40s, because your estrogen levels are really dropping rapidly from the age of 40, and obviously, so if you can just start premenopausally and just keep tweaking, I mean, that confidence, that feeling of feeling like yourself is so powerful.
And doesn't it make our job worthwhile?
Oh, absolutely.
That's 100%. Kind of one of the drivers, isn't it?
Yeah.
Being able to make a difference to people's lives.
Definitely.
So we've talked about the face with the thread lifts. Is there anywhere else on the body? Because I'm kind of thinking of other places that I could do with some thread lifts.
We've tried threads on lots of parts of the body over the last 10 years, and I think the only other place really on the body that they're good is the breasts. And even then, it's very few people who are suitable. So you can't have too much laxity. We don't treat anybody who's had an implant. I don't want to be popping anybody's implant or anybody's had previous breast surgery because their anatomy's changed. So it's usually people who breastfed. because obviously your breasts
amazing.
I mean, yes, it's wonderful your babies but into your body.
Yeah, a lot to
So people who've breastfed and they've lost volume and they're and just as we're going towards menopause, and actually so even some of my younger patients haven't even breastfed and in a menopause, they just don't like the way their breasts look. So we give breast centimetres lift of the nipple, but the people who are suitable are usually anything up to a C cup. Bigger than that, the tissue's too heavy. So anything up to a C cup is usually okay. And if you think of the anatomy of the breast, you have your nipple and you have the fold, we call it the mammary fold where the skin hits skin. If your nipple is on that or above it, you're suitable. If your nipple is below the mammary fold, then there's too much laxity and then you need a surgical breast lift, which is obviously much more invasive. But a lot of people are suitable. We put about 20 threads on each side. We do a row just behind the nipple and a row slightly higher up.
Gosh, that's
and then you get some volume here because of the volume of the threads. Plus you get about a centimetre's lift. And a lot of people who are asymmetrical, you can sort of get them to put slightly more on one side than the other to tweak. Or some people have breasts that turn out. You make them turn in. And we've got some photos that we can share with you. So I think it's a nice treatment, but it's a very small number. Lots of people who come to see me for breast threads aren't suitable, unfortunately, and they would need surgery. But it is a really, really satisfying treatment.
Yeah, how fantastic if you are suitable, because not everybody wants to go through surgery.
No,
so
a surgical breast lift is massive because they take the nipple off. They obviously. Then you have a scar going there and then all around the nipple. So it's a major procedure.
Yeah, and of course we have to tattoo those so that they're not noticeable. But that's a fantastic idea. Obviously, I know from being at the top end of permanent makeup and the artists that are here in the clinic, we have to be working at this all day, every day. And when the artists are not here, they're practicing. So how important is it that if you're choosing somebody to go to for like yourself to have the thread lifts, how important is it that you do these all the time and this is your absolute specialism?
It's really important, more than any other aesthetic treatment.
Right.
Dermal fillers and Botox you can get away with, I think, more so, although you should still go to somebody who's fully trained and doing it all the time. But threads, they have a really bad name, and there are lots of complications from them, and it's because people aren't doing them often enough, so they're putting them too deep and damaging deeper structures, or they're putting them too superficial and you can see them and you get puckering and dimpling, and this is because it's not down to a problem with the threads, it's down to a problem with the practitioner. So you really need to be doing a lot of threads. You need to have good training, and obviously Victoria and I are trainers for silhouette. We're key opinion leaders for threads. It's our passion. It's, as you say, it's our baby. We do it all day, every day. So if you're looking for somebody, I mean, lots of my colleagues just say, I'm just not doing them, and send them to us. We'll send them back to them for their fillers and everything else, but they send their thread patients to us because we're doing them all the time. And I think if you're looking for somebody for thread, just make sure they're doing them all the time. Ask to see their before and after photos. It's so important. And just ask them about their complication rates, their infection rates, and also that you check that they do see you for follow-ups afterwards. We see everybody at 2 weeks and at 3 months after every thread lift to check that the results are where they should be. And it's also down as well to the person's experience of doing a lot of threads, of picking your patient. Patient selection for threads is paramount. If the tissue's too stretchy or too heavy, the results aren't going to last. You'll look great for 2 weeks and it'll drop. And so somebody who's not doing threads very often will just treat you with threads, and then you'll be disappointed with your results. So somebody who's doing, we were saying, let's say at least one a week, but ideally one a day, just so that they're doing threads all the time is really, really important.
Dr. Charlotte, whilst I've got you here, so many of our clients are coming in now, especially two things. One is because they're on Zoom all the time, so it's lockdown and COVID, but also because of the latest thing about Ozempic and the drug that helps you to lose weight. And for those people that can take it, that's really successful, they've dumped shed loads of weight, but their faces, they're really unhappy. They love the fact they've lost the weight. So I'm thinking, how would these work, these threads work for people that have lost weight on Ozempic?
It's so important. So I think we were chatting earlier, we were saying that people, your face looks better when you're slightly overweight.
Yes.
But we don't want to be overweight. And Ozempic does work. It's amazing. If you don't get the horrible side effects, then it's a wonderful drug. You can lose 3 stone, or even more. And I think, yes, and then you see it in the face. Because obviously you lose your fat, and you're already, as you're aging anyway, your fat pads are sliding.
That's right.
But also that superficial fat layer that keeps you looking healthier goes, so you need to put the collagen back to actually thicken the skin again. So it's really important. So what you were saying about polynucleotides, they're really good after weight loss. And also things like Alonze to put the collagen back. And then threads will lift it and put it back, because what you'll notice is your face will drop because the fat that's been holding it has gone, and so suddenly you feel really jowly. And so quite often, if you've lost a lot of weight, we have to do Alonze or Morpheus or polynucleotides first to thicken the tissue back up, and then the threads, and they get amazing results from that. But anybody who's slim, we have a lot of people who are runners or people who exercise a lot because they like being slim, and you see it in their faces. So you just need to tweak and just keep your face looking plump and healthy, as if you're half a stone heavier than you are.
And of course, we naturally have fat pads on our face, which gives our face shape and form as well. So it's not just excess body weight, but it's during the passage of time when we're actually aging and we go through the menopause, that everything kind of drops because the support system's gone. So this is just like putting the support system back in for so many reasons. So weight loss, just general aging, just to make yourself look and feel better, and to also, we know now that this would probably stave off having to have facelifts in the future.
Completely.
It's amazing.
The ageing process is quite harsh when you think about it. I mean, from the age of 20, we're losing about 1% of our face every year, and
Is that right?
your bones are shrinking, so that's why your cheeks go flatter. Your bony orifice is getting bigger as the bone shrinks, so your eyes go further in, so you get the hooding, and then your lips go thinner because they're turning in, because again the bony orifice and your gums are shrinking. So you've got the bone shrinkage, plus your muscle and fat are reducing, plus your collagen levels are dropping, plus your fat pads are sliding, and they can't go any further than here because you have a retaining ligament, hence why you get the lines here and the line here and the gels. And that's just all normal aging. So your face goes from this beautiful heart shape to oval because the volume from here is down here. So by using thread, you're keeping the fat pads up, you're keeping your volume, and it's keeping that heart shape.
And that's what I love about your approach. I mean, you're obviously really well known for what you do, and your safety profile and everything is incredible. And for me, I want to work with people that I absolutely trust to do the best job. And what really impresses me when I speak to you is your holistic view of aging on the face, and pairing that up with how psychologically that affects both men and women, all of us, in fact.
And lifestyle as well.
Yeah, and lifestyle. But you're addressing the skin, you're addressing the natural morphology, you're addressing lifestyle changes, aging, all of those things, and combining that. So that is so bespoke to each person. And to have the knowledge that you have is amazing, to be able to give that to somebody and make the difference for them.
I think because Victoria and I have both been GPs for 20 years.
Yes.
So we've both been in aesthetics for 20 years and then GPs for 10 years prior to that. So we've been GPs a long time, and you get to see the lifestyle and just generally how healthy people are, who exercise, who eat well, who drink water, who sleep well. All these things are, and if you don't do those things, you prematurely age facially. So it is important, and the sun as well.
The sun,
The two biggest aging things is the sun and smoking.
Yeah, absolutely.
That they are, anybody who smokes looks 10 years older than somebody who doesn't, and people who are sun worshippers look 10 years older.
Yeah.
And so anybody who's very young watching this, try not to smoke and use sunblock every single day.
And hope is at hand.